Again, I want to say to all the frontline essential employees, thank you for what you're doing day in and day out. And thank you to everyone who are staying home, isolated, doing the right stuff, and listening to everyone out there. We'll get through this. We'll get through this together. It's a marathon, not a sprint. And take a step back and a deep breath and reimagine what it's going to look like when we start to reopen it up. But I do want to say today's a good day, because no one passed away last night, so which is good. We have 1,375 positive cases of the coronavirus. That's up by 12. We have 913 people under mandatory quarantine. That's down by 66. And then we have 17 people that are on precautionary quarantine, so which is all good. Good news. And we have 3,388 people have completed quarantine, and 837 tested positive for the virus and have recovered. That's up 14 from yesterday, and we're up 94 people that came off of it. All good stuff. We have 31 people hospitalized with a hospitalization rate of 2.25. It's up a little bit from yesterday. Yesterday was 2.2. We still have 7 people in the ICU. That hasn't changed. And over the last 5 days, there has been an average of 19.6 new positive cases each day, which is good news too. With the aggressiveness of the mobile testing that we're doing, the testing at Rite Aid, Albany, and Priority 1 in Gilliland is all good signs that we're getting more testing done in Schenectady and Rensselaer, and our numbers seem to be on the decline, which is all good news, which tells me everyone's been listening, staying home. As always, I'd like to remind people, if you want to make an appointment for our mobile testing, it's area code 518-465-4771, area code 518-465-4771. And, or, you know, if you want to go and find out the full testing for the mobile sites, you can go on our website as always. We recommend that. RiteAid.com, that's the only way you're going to get through Rite Aid. We had some questions on our, I think it was our Facebook or email. People who showed up couldn't get online with a computer. I'm sorry, that's the only way they're doing it, because that's run by the feds and Rite Aid. So you have to go on the website, and if you can't get access to the website and you can't get through Albany, call and get our mobile testing number. Call our mobile testing number, and we'll set you up there. You know, I know it's really for walk-ups, but if you don't have internet access, please, people, call that number, 518-465-4771, and we'll make sure we get you tested if you can't get online to register for Albany or for Rite Aid, or you can also call the doctor's office in Gilliland and get tested there, too. The Priority 1 Urgent Care in Gilliland, some good stuff going on there. We're announcing today they're doing an antibody testing as well there. So if anyone wants to go and get that testing done, you can call there and get scheduled to take it. There's a few questions you're going to have to answer, but that's good if you want to find out where you stand with it. If you had it in the past and you didn't have signs and symptoms, it's a good thing to do. Yesterday, Governor Cuomo announced that the regions of New York meeting all 7 matrix would be reopening this Friday. As everyone knows, we'll have our plan going forward. We've been working hard to meet that matrix, but there's some difficult things. We here in the Capital Region, we hit 5 out of the 7 so far, falling short on declining hospital and deaths in hospital. It's a question I raised on Saturday's meeting with our regional control room. And the same question I had yesterday was that, the death rate is kind of hard. We have a lot of nursing homes in our region, and of course unfortunately that's ground zero. We've known that from the beginning. If you've seen what has gone overseas and downstate and across this nation, unfortunately that's just has happened in nursing homes, and we're dealing with it the best that we can. So we've asked for guidance for that not to contribute to our number, which we have not got back. Also looking at the hospitalization rates, I've talked to the governor's people in the control room about giving us the numbers, because Albany Med is not just a capital district hospital, it's a region hospital. They have people from outside our region, and so do other hospitals here. So that's something that has to be addressed too, because that shouldn't be held against us. Because on the earlier matrix, we met that requirement. Under the new matrix, we did not. Which is something that we need to address to continue to go forward to try to open up. But some of the things we put up for clarification that we're trying to find out with reopening, barbershops, salons, places of worship haven't really been addressed. We put that part of our plan for worship to go forward. These are things that people want to know, and what phase can they open up, and I know some people are defining it and opening it up. So we need to address that in through all this, and that's what I'll be doing today too. There's a lot of things we need to hit the hash mark on, but we need more information coming from the state on guidance of how we're going to do certain things to meet that matrix. And hopefully when we submit our plan, it'll be either, probably, I was hoping by tomorrow, but when you're dealing with counties outside of my control, and they have to take their time and read through it and go through it and put their input, because this is a regional approach. So I want to make sure that Greene, Columbia, Warren, and Washington all have the same say that we do and have the same issues. And they have different issues than we do. Like some of it was more farming and agriculture, which we addressed a little bit. We do have 400 farms in Albany County, but it was issues like that we had to address for them, and rightfully so. So we can all open up together as one. So there's different things we're working at, and we're going to be figuring it out. Some of the other things, we had questions off topic when we were talking about it was how do you address nursing homes? How do you address testing people twice a week? And we've gotten a lot of questions from people on this. I don't know. I really don't know. We're still trying to test every nursing home right now from 3 weeks ago with the guidance when the state asked us for help. So we've been working on this for three weeks now to get the guidance, and we do have the PPE now, and get the people trained so we can test everyone once. To do every worker and resident twice a week is a little bit much. I don't know how you do that with in Steve McLaughlin's brought up the point in Schenectady County. I talked to them and other counties, executives across the state. It's something that we're going to have a hard time achieving because of laboratories returning the test. And most importantly, by the time what you do, test a worker on Monday, then you test them on Friday. Well, by the time you test them on Friday, the probably results for Monday aren't back, and you're just going to be playing catch up constantly. And a lot of workers, I don't know, people who've gotten the testing done, it's not comfortable. No one likes getting, swabbed down that far down their nostrils. It's very uncomfortable for a lot of people. So to now to ask that people do it twice a week is going to be tough. It's going to be a tough thing to manage. And we're looking for more guidance from the state, from state DOH, which please, DOH, give us guidance on how this is going to be done and how we're going to do this going forward. We want to comply. We want to do it. We've been aggressive at our nursing home since day one. We've been aggressive testing out there. We've been aggressive with all the issues out there. So I want to thank my staff, and I want to thank the families that have families that are in our nursing homes, because they're our family, and we want to make sure at the end of the day we're doing everything we can to protect them to go forward. Like I said, it was, this control room's good. We're having a meeting today at 1400 to talk about a variety of things, and I want to thank the county manager, Rory Forum from Schenectady County, Steve McLaughlin, and our Columbia County Board of Supervisors Chair, Matt. Been all great to deal with, and we're going to get together more often, and we're going to get through this, working together in a partnership to make sure we're all on the same sheet of music and we're all going forward, because there's not one of us that have said we don't want to just open up the doors and worry about the health and safety of our residents. We want to do this where we open up the doors and we do it a little at a time, so we don't, it's still there. Our numbers are on the decline, but Dr. Whalen can talk better about this than myself, but it's there. The virus is still there, and until we get a vaccination for this, it's something that we're going to deal with going into the future with restaurants and everything else. Some of the business owners got back to me, some questions I'll be asking today at 1400 is basically now I don't know if it's the feds or state was saying that if they got a grant, they got to bring all their employees back. They're like, well, how do I bring all my employees back when I'm going to have less restaurant space to set up tables? And I'm not going to need the staff I used to have. Businesses that have lost 40% of their business is like, well, I have to build up my clientele and I have to build up my business again. So these are going to be, this is, again, we're going to stumble, we're going to make mistakes, but these are things we have to readjust, and we have to work with the business community, because like I said before, they're our backbone of our community, these small businesses, and we have to help them get through this to open back up in a safe way, and what it's going to look like when you go out there. And a lot of the recommendations we're making is take the temperature of your employees every day. Make sure everyone's cleaning their hands. When people come into your restaurants, you can take their temperatures. You can say you gotta wear gloves, or whatever it's going to be. It's going to be for a while, and that's what we have to figure out, working together, and we will, and we'll get through this together. Working together, we're going to get through this, and listening to everyone how we can do this. Because listen, I got into some debates with business owners and construction owners. If I knew how to run a restaurant, I probably wouldn't be county executive. If I knew how to run a construction company, I wouldn't be county executive. So I'm relying on them. They're the ones that have to tell us what works and doesn't work. And the same thing in the private sector. We're figuring out the matrix of how to bring our employees back soon. And when they start coming back, how we're going to stagger out. And we're sharing that plan with other businesses, private businesses that are in downtown Albany, how we're going to work this out, how we're going to spread the workforce out. And, we got some great plans. We're not going to be using our Times Union Center for a while. We're going to be using it to house workers. We looked at our hockey facility. We're looking at all the properties that we own, how we can spread workers out and bring them back in a safe manner. And that's the same thing we're saying to other business owners in downtown Albany, throughout the Albany County, and actually on a national level when we've been talking to other county executives of how they're going to do it there too. So we're in this together. And that's why I say to everyone sitting at home, be part of the solution. Don't be part of the problem. It's easy to just criticize everything. Give me your ideas. There's a lot of people that have commented, and I got to tell you, we've added it to our plans. Things we don't think of everything. We're not perfect. We're gonna forget some certain things as we put this plan together to give to the control room and to try to open up. But the more input you the more input you give us, then we can utilize that to open up. So I'm saying to you, please be part of the solution, not part of the problem, and help us do this in a safe way, and we can do this together, working together. So I want to say thank you to everyone that I'm working with in the control room, and and look forward to getting our plan there by Friday. But Dr. Whalen.
Thank you, County Executive McCoy. So as you've indicated, the numbers of new positives every day continues to be on a downward trend, and this is certainly encouraging. Last week we did talk about the expansion of available testing for essential workers, and among those would be asymptomatic essential workers. We did see a slight uptick in the amount of people we were testing per day, on the order of 50 to 100 extra tests per day, but we are not seeing an increase in positives. So this is certainly encouraging. We continue to monitor these trends going forward, and look forward to basing our guidance for opening up on these and other very important metrics. In terms of the nursing homes, as the county executive indicated, we are working closely with the State Department of Health and our nursing homes to ensure that we can move forward with the point prevalence initiative. And what the point prevalence initiative is to ensure that every nursing home resident and staff member has been tested in a short time frame, so we can get an idea of what the seroprevalence, or the amount of people that are positive in a time frame, is. Our nursing homes have all been very cooperative on this. Many of them have done this testing very recently. So right now we're working with them to fill in the gaps. We have received extra test kits for this purpose from the state DOH, and we have been providing them to the nursing homes on a daily basis. We continue to monitor practical considerations like lab capacity to get these tests run, and staffing considerations for nursing homes. These initiatives, while definitely helpful to address the high rates of morbidity and mortality we're having in nursing homes across the state have to be considered from a practical perspective too. So we are looking for additional guidance and have a call later today with the state to learn more about both the seroprevalence initiative and the new mandate to test nursing home workers twice weekly. Again, the theory behind this, which is good from an infection control perspective, is if people, this is a layer above what's being done. What is being done already is that people are being screened as they enter the nursing home. The workers, they are having their temperatures taken, and they are being provided with appropriate PPE. This will give an additional layer of comfort in knowing if individuals test positive. As we have discussed, we have seen incidences of people who are asymptomatic who may present a risk of transmission. And this would enable us to ensure that these individuals were placed under mandatory quarantine and kept out of work until such time as they don't present a danger to the residents that they work with on a daily basis. But as the county executive appropriately indicates, there's a lot of practical considerations that go with this testing, and it needs to be well thought out in terms of resources, in terms of lab, in terms of staffing, et cetera, so that appropriate continuity of care can be maintained. So we look forward to continuing our work with the state DOH and hopefully being able to provide more information on that in the coming days.
Thank you, Dr. Whalen, as always. And again, doing this together, we're going to get through this. Working together, we're going to get through this. Leaning on each other, we're going to get through this. Listening to everyone, and here's the key to some people, listening to other people other than yourself, we're going to get through this. We will get through this. We're Albany County, we're the capital district, we're state of New York, we're strong, and again, things are going to be different. So we will get through it working together and finding answers for the problems, not adding to the problems. But some good things about Albany County Cares is we have a lady, Kathy, who's been doing shopping for one of our DCYF families each week this month. She's even included a warm cooked meal, and she's helping neighbors. And that's what it's about, people helping people. I love these type of stories, and please, people, send them in. Let us know what you're doing, because that's what it's about. When we're at our worst, taking care of the people around us and helping out. You know, you might have that neighbor next door that can't go out grocery shopping or can't get out of the house, or that senior citizen or somebody that just can't get out or doesn't have the means to get out. Please, help them out. It might mean just bringing their garbage cans in after, you know, the garbage is taken away. It might be helping them mow their lawn. Whatever it may be, please take the time and work with the people around you. As always, too, our mental health support line is available 7 days a week, 8 a.m. to 8 p.m., and the number, as always, is area code 518-269-6634. Our 24-hour sexual assault hotline number, area code 518-447-7716. And our 211 number, as always, in the New York State hotline is always up there for you, too. And again, thank you for everyone that is doing what they need to do so we can reopen.